Many people have reached out to me, deeply concerned about the shortage of ADHD medications and that those shortages are getting worse. Is it correct that 30 milligram Vyvanse is on the medicine shortage list?
It is correct that there is a current shortage of 30 milligram capsules of Vyvanse. That is expected currently to resolve on the 31st of December. An anticipated shortage of Vyvanse 20 milligrams was resolved on the 9th of October, and in fact that shortage did not eventuate. Other strengths of Vyvanse are not expected to be affected. The shortage itself is global and due to manufacturing issues, and we're working closely with the sponsor. As we do with all shortages, we're working closely with the sponsor and also health professionals to expedite the deliveries to Australia and to manually allocate stock to ensure equitable supply and to prevent stockpiling. The sponsor, Takeda Pharmaceuticals, sent a letter to prescribers and pharmacists on the 10th of August 2023 with information about the shortage, advice to limit new initiations to ease demand where possible and to enable thereby maintenance of Vyvanse for patients who are already established on that therapy, and as well as that to provide contact details for healthcare professionals to contact Takeda directly for information as required.
Okay, thank you. So the 30 milligram is on the shortage list and is expected, you said, I think, to be resolved by the 31st of December. Does that mean that on the 31st of December there will no longer be a shortage?
We expect the shortage to resolve by the 31st of December. It may be earlier than that, but I would highlight that there can sometimes be some supply chain challenges to restoring universal and homogeneous supply across the country.
Yep. And how long has it been on the list?
We have on the medicine shortage database, which is a publicly accessible database, that the supply impact dates have been from the 7th of August to the 31st of December 2023 for the 30 milligram tablets, and if there's any correction to that I can certainly provide.
In terms of stockpiles, what stockpiles are we at for Vyvanse 40 milligram, 50 milligram, 60 milligram and 70 milligram capsules?
We don't maintain stockpile information, Senator, but we're not aware of or have not been informed of any imminent shortage of those other strengths of Vyvanse.
Okay. And just so that I can address community concern, what is the process by which you would become aware of a shortage?
The process is that we would be notified by the sponsor of an imminent shortage, and that's true for all medications that are listed on the Register of Therapeutic Goods, along with those that are deemed to be critical shortage issues. And we then obviously work with the sponsor, with consumers and also with health professionals to ensure that access to a medication is maintained as effectively and continuously as possible, particularly for those who most need it.
Okay. Can I just clarify that? Is there an avenue for members of the public to make yourself aware of local or regional or state-based shortages that they are experiencing?
We're always very happy to receive any concerns directly to our contact details, which are accessible through our webpage. We maintain very open communication with suppliers and sponsors to ensure that we're aware as early as possible of any imminent shortages.
Thank you. Given that there is a global shortage, what has the federal government done to ensure that Australians, young people and people who have recently lowered their doses of Vyvanse are able to get their medication? Because if you're going through that lowering process, obviously that's something where you need to have a continual supply.
Senator, thank you for the question. I absolutely understand the personal and therapeutic impact on individuals of discontinuation or interruption of the supply of this medication. We are not in a position to compel suppliers to make commercial decisions in terms of the provisional stockpiling of medications. But what we do, as we have done with Vyvanse and indeed other medications that we find to be in shortage, we work closely with the sponsors. We also work closely with jurisdictions and with health professionals to ensure that there is limited stockpiling in one area, that there is as much as possible appropriate and equitable distribution across the country. I know that this is not specifically your question, but as MPIC is a really good example as well, that we encourage the retention of medication for those who specifically need it, as opposed to off-label prescription as a specific issue, obviously, with Vyvanse, given that it's an S8 and there are state and territory-based restrictions around that as well. We also work with professional bodies such as the College of Psychiatrists or the College of Physicians around what alternatives may be available.
Sorry, Senator, can I just also add to that? We've also also approved at the TGA, we've approved overseas alternative to be supplied in Australia that is registered in a comparable overseas regulator. So that alternative supply is available as well in the 30 milligram. I don't have that name on me, but I can provide that.
Get it for us on notice. That'd be great.
And sorry, Senator, just to add to my colleague's addition to my response, we actually do have on our website, on the medicine shortage database, the details for the approval holder of that alternative medication, so the practitioners or pharmacists can contact that supplier to arrange supply.
Okay, thank you. Now, just my final question is, acknowledging that there is a shortage, as we've discussed, has the federal government considered changing the rules around paper prescriptions for Vyvanse so that people can more easily try a different pharmacist?
That's not really within my scope as Senator, but I would just highlight the fact that many of the prescribing requirements are actually determined at a state and territory level through local Poisons Act and regulations.
Okay. Can anybody answer that question about whether that's been considered?
But normally a script is not limited to a particular pharmacist. So I don't know why someone couldn't choose any pharmacist they want who's a registered pharmacist.
I think there's a particular issue around paper prescriptions, but I can get you some more information and we can have a
That's not my understanding.
So, sorry, Senator. So another tool that we can implement for medicine shortages is what's called a serious substitution instrument.
Yep.
Unfortunately for Vyvanse, because it is a Schedule 8 controlled drug, we cannot issue a substitution instrument, so the pharmacist can't substitute, for a similar or for a different form and strength of that drug. So it is a little bit complex for this drug because it's a Schedule 8.
Yes, because it's a Schedule 8. My question is whether you considered, I understand the Schedule 8 challenges, but for the period of the shortage, modifying those rules so that you can see a difference. For anybody that doesn't know, not having these medications when you need them is the pharmaceutical equivalent of me not having a wheelchair for the same period of time. It's quite serious in terms of its impact. So
I can only reassure you that I'm fully cognisant of the impact on individuals that discontinuation have. I do know for a fact that, as I've mentioned, that there are variations from state to territory, but there are instances in which individuals are able to access this medication through an e-script. So there isn't a requirement universally for a paper script. But I think also that's slightly separate, I think, to the question of the substitution of one medicine for another.
Wouldn't it be great if we had a nationally consistent response? Thank you very much, Professor. Thanks, Chair.